Integrative medicine is taking multiple specialties that converse with each other, whether they're under the same roof as the same company or they are a collaboration of really good practitioners that can work with each other on a certain case to give the patient exactly what they need for the best result. A common question I get asked: you say integrative medicine, you lecture on integrative medicine. What is integrative medicine? Integrative medicine is not a podiatrist renting space from an orthopedist office and they're integrated. Integrative medicine is taking multiple specialties that converse with each other, whether they're under the same roof as the same company and treating individuals together, or they are a collaboration of really good practitioners that can work with each other on a certain case to give the patient exactly what they need for the best result. So we have 13 in accessible Beltway clinics or ABC clinics. We have 13 integrative medicine practices. And what I mean by that is that we have medical doctors that work with us in each category. We have chiropractors, physical therapy, acupuncture, some behavioral medicine, even some MAT treatment, which is medically assisted treatment for people who are addicted to opioids, which is one of my specialties, and I'm a national lecturer on the topic. I think when you look at an integrative model, it's so broken. Medicine is so broken, and I'll just briefly explain why. When you go to a physician and you have your conversation and you leave with that little white piece of paper and that's all you had done, you missed everything in between. So if I'll give a good example is looking at the opioid crisis. Now, of course, it's my expertise, so I like to bring it up in topic when I have a discussion. If you have a system that is set up where everything that's pain-related has a prescription to it as opposed to integrative modalities that you can treat through, the system's broken, and you're going to create people who get dependent on those medications and eventually become addicted. Now, in an integrative medicine clinic, we will have you be evaluated first off on we treat through pain. We don't prescribe through pain, because treating through pain is going to fix a problem. It's not going to head you down a path where you're dependent on a medication to get through the day. When your body has this innate ability to fix itself, why aren't we allowing that? So having the integrative tools and using different professionals, different specialties to look at one person to get you through step by step, so that when you're done and you're treated, you're actually done. Because the medication didn't fix anything, so you're going to be continuing to take medication, and that's where dependency comes from. So at accessible Beltway clinics, we have this uncanny ability, and I hope and pray that medicine takes this path and follows lead. When we have 13 places, and I lecture all over the country, and when I'm finished with this, there's several questions I could ask. One of them is, would you please explain what this integrative model looks like? And there's some really good places doing it. We're one of those really good places. And accessible Beltway clinics, our integrative modalities and our integrative medical practice, and including chiropractic and physical therapy, is hands down the way to go with any pain syndrome, trauma, sports injury, workers' compensation, accident cases, or if you just slip and fall at your house, go see somebody first that's not going to give you drugs or head a path down to surgery. Go see somebody that's going to take care of it in a more holistic, integrative way.